coming home.
I think it's important for the community to understand the difference between having an adult provider that is taking care of their child versus having a dedicated pediatric provider in a dedicated pediatric system. For the high-level cases, there's no question, but for simple cases, there's still substantial advantages from having child life that can make your experience comfortable, from having the facility in place that's child-friendly, from having anesthesiologists that are only pediatric trained that can get that child to sleep and wake them up quickly and easily without having the typical type of perturbations that occur along the way, and the fact that we make all of that extremely kid-friendly.
Ready?
The American College of Surgeons is the body of all surgical specialties, and they are one of our accrediting bodies. Children's Mercy, we were verified as a level 1 center. That means we are able to provide the highest level of care in every subspecialty with purely pediatric practitioners.
Are you gonna help me? Are you gonna help me?
Children aren't little adults. They're very, very different in their physiology. And by being here at Children's Mercy, I've been able to work with the anesthesiologists, the neurologists, to develop a comprehensive pain management plan for my patients. The team approach that we take here at Children's Mercy Hospital really sets us apart.
Most of the hospitals in this area have little to no pediatric anesthesiologists. The average adult hospital puts less than 200 kids a year to sleep. That's less than 1 a day. Here at Children's Mercy is 27,000 anesthetics, which is 74 a day, and we only have pediatric anesthesiologists.
Whether it's a baby, whether it's a toddler, whether it's a high schooler, you see how much life they have in front of them, and you so badly want it to be a good and full life, because what we do at times can be extremely high risk. From an emotional standpoint, that's sometimes where the pressure comes from.
What's awesome about the team that I get to work with is that we're constantly pushing one another to improve ourselves. We're treating families and patients as individuals, as opposed to as a diagnosis.
Alrighty, we should get started here shortly.
All right, thank you.
At Children's Mercy, our goal in surgery is to represent the highest level of care, either within the published literature or generate that published literature. As a result, instead of practicing standard of care, setting the standard of care. What really makes us separate from any other facility in the region is having dedicated pediatric specialists in every subspecialty and having a facility as well as all personnel designed for taking care of children. I would never consider taking my child somewhere else.